Hey everyone, welcome to Group Dentistry Now's DSO Study Club webinar series. I'll be your host for the next hour, Bill Newman. Thanks everybody for joining us. I know it's summertime and kids are headed back to school for a lot of you, but we appreciate you taking an hour out of your day to spend time with us. We have with us Ryan Gross, who is the founder and CEO of Grapevine Marketing, and he'll be taking us through um, this presentation. He's got a deep experience working with dental practices and group practices on marketing. And we also appreciate Cleary for sponsoring this webinar. We're going to take a couple of minutes to let people file in, and then we'll get going. We'll give everybody about 2 or 3 minutes. We've got some poll questions that we'll be asking. Promise they're not difficult, so you should be able to answer them, and we sure hope you do. And thank you, everybody, for all the great questions that came in ahead of time. We will be answering your questions as we go along. And if you happen to have any questions, as Ryan is starting the presentation, and throughout the presentation, if he sparks some questions or thoughts, please shout those out in the Q&A area. If there's any issues hearing us, of course you can, or any issues with video, just put something in the chat and give us a warning. But I think we're coming through good. Does it sound okay on your end, Ryan?
Sounds great. Thanks for having me today as well.
Good, good. Yeah, this is going to be a great conversation. Like I said, I'll give everybody just a couple more minutes to file in, and then we'll get going. The recording will be available. We tend to have the recording up either late afternoon, which we already are in on the East Coast, or early evening. It'll be on our website. It'll also be on our YouTube channel, and then we will send everybody a link tomorrow with a link to that video. You get an email with a link to the video. And then also you'll be able to reach out to Ryan. His contact information will be there, be at the end of the presentation as well. But in that email, as well as information on how to contact Cleary to find out more. But I think we are pretty good here. I've got, we're at 3:02 Eastern. So I think what we'll do is we'll get things started. And I think that was all the housekeeping I had. Q&A for any questions you have to come up. We're going to be polling throughout the presentation. Recording will be available right afterward. And yep, I think I got everything. So why don't we kind of move through. We'll go to the first slide, and Ryan can introduce himself. Again, he's the founder and CEO of Grapevine Marketing. But Ryan, I'm going to let you start things off, and then I'll interject throughout, and I'll be monitoring and the attendees' questions, and then also doing the polling.
Yeah, thanks again for having me on today. Like Bill said, I am the founder and CEO of Grapevine Marketing. We've been around for about 7 years now. My experience prior to this and how I got into dentistry was I spent a lot of time, most of my career in the attractions industry, worked for the Walt Disney Company, museums, zoos. A good chunk of the time was spent in those industries. And so it was about 7 years ago, I knew a dentist who was looking for some marketing help and he's like, hey, would you like to be a fractional chief marketing officer for me and a couple other dentists? And if anybody knows Dr. Mark Costas and the Dentalpreneur podcast, I was working with them at the time, and I said, okay, let's jump in and do this. And that's kind of how I got started into the dental field. But I think what's interesting and why a perspective that I have on dental marketing and that makes it a little unique is spending time in the attractions industry is really about experiential marketing and using data to understand how to reach, in those case, your guest, and how to reach the best guests, how to convert them. And dentistry is a lot of experiential marketing. It's talking about, your practice in a way of what's the experience when they going to get there. And today, I think we're going to go through some very good, very good data and go through some good segments on talking about experiential marketing, how to use data to make the best decisions for your practice. So again, thanks for having me here today, and I'm excited to get started.
Excellent. Yep, we're going to do a couple of poll questions here, but obviously the focus is on new patient growth. We're going to also talk about the importance of membership plans. And, we all know that acquisition costs are rising, PPO economics are tightening, and there seem to be more and more underinsured patients out there. And that can be an opportunity as well as underinsured. So we'll talk a little bit about that opportunity there. But I think affordability is something that's key, especially in this market. And there's again, we talked a little bit about Cleary and they're sponsoring this. So we'll talk about some of the benefits to a membership plan. But we want to find out first off who's in the room right now. So I've got two poll questions. I would appreciate everybody, just super easy ones. I'm going to launch it right now, but number of locations that you have, if you don't mind, and then what your role is in the organization. So hopefully everybody can see that and love to just get some feedback from some people. Okay. Got a couple going now. Give everyone about like 15 seconds or so to answer both, and then we'll kind of go from there.
And Bill, while people are answering, you talk about what's up on the screen right now is questions that we get as a company, and I get often with the practices we work with of dropping insurances, how to reach these higher paying patients, and so it's changing dramatically. There's some phenomenal facts on what people are searching for in dentistry and how they're getting to dental websites. Based upon financial questions that didn't exist, 1 to 2 years ago, that the amount of people looking for a dentist based upon their finances has dramatically changed, especially from the membership side of things, how people are looking for alternatives to insurance or to self-pay.
Let's take a look at the results. We have a real mix. We've got 33, 33, 33. So it's small, medium, and large as far as the size of the groups that you represent. And we've got people that are in marketing and operations. That was actually a question that Ryan had prior to us actually starting the presentation was who's going to be on? So I think I hit it pretty well, right? I said operations and marketing.
Home run, yeah.
All right. So that was the first poll, and we've got a couple others that we're going to be sharing throughout as well. But I guess why don't we kind of move on here to
Yeah.
this next slide, and we've got these are some of the questions, are the first questions that have come in, and again, appreciate all these great questions. So Ryan, this one came in. How do you distinguish between a marketing problem and an operational conversion problem when a practice is struggling with new patients? And if I remember who asked this question, it was somebody in operations.
Yeah, that is a phenomenal question. First of all the questions that came in ahead of time were great questions. And so that's a very good question. And the very first thing that I talk to when I talk to practices when we're having this discussion is you got to look at the numbers. And so, what we do typically is we look at the operational metrics and the marketing metrics to start a conversation on if there is an issue with conversion. So, you can take right off the bat and look at phone data, for example, and say, okay, here's how many inbound phone calls I had. You can look at the marketing data and understand how many conversions you had in terms of people attempting to schedule via phone call or via online scheduling. And so you can start with those two data points and say, okay, based upon that, and this is what we do. We have some software that allows us to, we sit on a very large data set in the country in the dentistry space, extremely large. And so, we've analyzed over 10 million phone calls, about 5 million different Google conversions. And so when you start to look at the data here, and how you can use this in your practices that you work with is, you want to look at that first is, okay, based upon the phone call data and the Google data, the marketing data, we would expect to have, say 50 new patients. Well, then when you get to the point of actually looking at new patients and you say, okay, well, we have 30, well, there's an issue right there. There's a problem between, 30 and 50 there. So how do you break that down? You look at phone call answer rates. Are they answering enough phone calls? And then you look at, is the team converting over the phone? Are they just not good at converting? And typically the issue there is capacity. They're maybe not have enough space, and that's actually surprisingly high. We'll talk to practices and we'll say we want 100 new patients, but they only have 80 new patient blocks. So I think you need to look at the data first, set an expectation or not expectation, but find out what the marketing and the phone data tells you, and then compare that to the actual new patient number. Then determine, is this a marketing issue? Is this an in-house issue? And try to address it whichever way. And, again, typically it's going to fall down to two things: phone call answer rate and capacity. And then, because if the marketing data shows that, if the marketing data, you want 100 new patients and the marketing data shows you just have 75 conversions, you definitely got to get 100 new patients.
Do you find, Ryan, that there's different platforms out there that are being used to monitor calls? And I mean, are most practices, doing that, or how's that being done?
Most aren't. That's, when I was in a room of about 500 practices in June, and I actually had, asked the question, how many people know their phone data? And very few hands went up in the air. And so, there's a lot of companies out there. We're a preferred partner with Mango Voice, who we have access to the data the practices are using. And there's a lot of tools out there that you can use that, Mango, there's other companies out there that provide that. So, if you are using a phone system that does not provide you data, that's something you need to look in right off the bat. Then from a marketing standpoint, if you're not being able to track your conversions through Google Analytics, Google Ads, and things like that, then that's an issue as well. There are some, programs out there that kind of pull it together. We have one of that we created ourselves that pulls all this information together and is able to give you what the anticipated or the expected new patient count would be. So if you again look at phone data, marketing data, and then your operational capacity, there we have a formula and a software that will say, okay, you should have had 185 new patients, you had 125, and it then explains where the 60 gap is. So there's ways to doing this in-house on your own, tracking it using software like we have at Grapevine. And it but there, it's just something you have to look at. You have to continually look at. Like we had a practice today I was talking to earlier this morning who had a 50% phone conversion rate, or not, sorry, 50% phone answer rate, and they were only converting 60% of the people who called that they answered off that 50%. So when you start to do the math there, it's pretty simple there. Answer more calls, and then staff training to get them to be able to actually convert those calls.
Next question here is, what's the ideal cost for acquiring a new patient in a PPO practice in a suburban area? I mean, does that vary state to state, or or is there an ideal cost?
Yeah, I mean, there kind of is. And, I think the first thing is these can be calculated in 100 different ways. When I was working for Disney, their thought is stick with something and be consistent with it. Because if one for 6 months you're calculating one way and then you switch it, it's just you're not going to have the historical data. So there is some ideal cost. And so what we typically would recommend is look at the total spend of marketing that you can attribute to something that's happening. So like a billboard, it's very difficult to determine what the ROI of a billboard is. But when it comes to Google, ads, meta ads or social ads, and what you're paying for your website and things like that, that's a fixed cost that then you can look at and say, how many conversions did we get from that marketing source? So what we do is we say, okay, let's look at just the spend from the digital side of things. So how we approach it is take the spend, the managing and hosting your website, plus your ad spend for Google or for social ads, and then you take that, say it's $5,000. And then you take the number of new patients that you have and you figure out what the new patient production per new patient is. And what we do is we look at that production per new patient over a 90-day span. And we know that that's usually around 12 to $1,400 right there. So if you look at, I got 10 patients and they spent $1,200, it's $12,000. And if it took me $5,000, that's a 2 to 1 ROI. So, that would be low. You don't want that. You want, like, for one doctor practice, you want like at least a 3 to 5, multi doctor practice, you want over a 10 times ROI off of that. But whatever you do, make it consistent. So that's how we always measure consistently every single month with every practice we work with. And as a DSO, what you want to do is you want to have this information presented weekly, so you can look at all the practices you work with, and you can say, okay, what's that ratio? What's my top practices? They're like a 10 to 1, and my bottom practices are 1 to 1. So you can start addressing the marketing issue there. But if to specifically ask, or for this question here, if you take a look at that spend, we usually look at that between $80 to $120 for a PPO practice in a suburban area. Again, that is using only the digital marketing spend, which would be website, ads, anything like that. So about 180 to $120.
And kind of ties into your last point there. You just said it, just the digital marketing spend. What is an average percentage of spend in marketing that, because I guess there's probably two, right? As you're starting a practice and then there's an established practice, but is there a percentage compared to revenue that you typically recommend?
Yeah, I started as a baseline. This is another conversation I had this morning with a group of doctors was, there's a lot of practices, or a lot of people out there will say, between 3.5% and 4.5% is what you have to spend. Well, I think you can use that as a baseline, but it really does depend, because if you are in certain markets and depending on what you're marketing for, that could be higher or lower. We have massive practice. We have groups that are $40 million who their marketing spend is 1.5%. And then we'll have another group that's like a $20 million group we work with, where their marketing spend is closer to 5%. And so it just depends on the situation you're in, where you're located. So yes, use it as a baseline. 3.5% to 4.5%, I think, is a very good baseline as a startup practice. Obviously, once you get past 3 to 6 months, we've had some practices who are spending 15% of that initial revenue in that first year on marketing, because what it'll do is it's a snowball effect of how much more revenue you will gain by spending up front like that. So 3.5% to 4.5% is a good baseline, but again, it's going to be based upon what works in your market and what's working for your practice.
Ideal number of new patients on average for a practice to grow consistently.
Yeah, that's another good question. Um, you know, it just, again, it depends on the situation of the practice. But the practice we work with, if they're not hitting 10 to 15% new patient growth year to year, then we're looking into it and understanding why that hasn't happened. Like the average practice we work with is around 21% increase in new patients per year. There's a lot of variables to that. We have some practices, though, that I say don't always focus on the new patient number. I think that is a little overdone in dentistry, is because you can take, and you can, especially how AI is involved in marketing now, you can take and shift your marketing to go after the acquisition of higher or more valuable patients rather than more quantity, and you're working smarter, not harder there. And so we have some practices who grow new patients at 3 or 4%, but their revenue has grown by 20%. And so I think you have to look at how your practice is set up, and what is in your market to be able to. For me, I'm always looking at, as a practice, when we start our conversation with the ones we work with and the groups we work with, is what's your revenue growth goal? That's where we start with, and we work backwards to figure out, do we want to hit this goal by hitting more patients, or just hitting better patients to hit that revenue goal?
And of course, the one thing that we don't really touch on here is, what are you doing to keep the patients you have, right? Keep them happy, recall, treatment acceptance, those types of things.
Yeah. Oh, yeah. That's the back end. Losing patients is, there's some areas. So we actually have some practices we work with where we know that they're going to lose a lot of or patients based upon their area, especially if you're in areas that are lower income, there's going to be a higher turnover. So you really have to understand that some practices need a large new patient goal every year just to ensure that they're not shrinking their active patient number.
Great. Well, I think we can move on to this slide right here. I've got if there's anything you want to talk about on this slide, I've got some more questions that kind of relate to this.
Yeah, so I think this was something that we get asked a lot too is, what are ways that you grow your practice? And so really there's different types of marketing strategies. There's the volume game, which is just getting as many people in as possible to try to get them as much production as they can in the visit that they have. It's not as much about retention, but it's much about upfront volume. Our strategy is more to be built around consistent, qualified demand and connecting the practice with the right patient. And that's a big deal, especially now with AI, because you can use AI marketing strategies to be able to get in front of a patient that's most likely to accept or to this first purchase your product, which would be an appointment that is going to be a higher value and more likely to convert as well, accept that treatment. And so I think it just really, again, it depends on the type of practice you have, but consistent, patient growth is what we recommend. And you don't want to have a roller coaster. That's just stressful. And so I think creating this consistent, qualified lead is a big deal. And then, bring clarity back into this, and the membership way here is, so memberships are a great way to market to a patient. And when you look at the numbers, this is actually very fascinating, is you'll see anywhere from 10 to 20% of new patients who are looking at some type of membership plan out there. Some areas we see 30%. That's a large segment of the audience when considering how many insurance-based patients that are out there. They're looking for memberships. And so that's another way, is so from a practice standpoint, you have people who are coming in to get their cleanings or routine, or they have an emergency. That's one segment of the audience. But there's a segment out here who is, okay, I need one of those things, but I don't have insurance, or I'm looking for an alternative way of self-paying. And so memberships are a great way to get in front of those patients who are trying to find an alternative. And if your practice does not, or your practices do not have that as a forefront in their marketing or as a part of their marketing, you're going to lose out on that segment of the audience just because there's so many of them. And if they can't see that you offer some type of membership plan, they're just going to go to the next practice that will find an alternative for them.
Yeah, and I think it's important. I don't know the exact percentage of practices or groups that offer membership plans. I know it's growing. I still don't think it's probably as much as we would think. But
Yeah.
when you think about patients and the retail mindset that they have now, I mean, they are looking for discount plans. They are looking for value. They also, I think, appreciate the transparency that you get,
Hmm.
which seems to be lacking in dentistry, but you get that with a membership plan. So I think there's a lot of reasons. And of course, you've also got that predictable cash flow that you have coming in every single month from patients that are on that membership plan. And you don't have predictable cash flow with patients that don't have membership plans, because you don't necessarily know if they're going to come back or not for that cleaning, even if it's the cleanings.
Correct. Yeah, and we were talking, when we were prepping for this, that you and I are both on membership plans. I mean, I don't have. Yeah, I think it's kind of funny. I own a dental marketing company, but I'm on a membership plan with my local dentist, and it's very advantageous for me. It's something that and I'm actually probably sometimes an ideal patient for a membership plan, because with my schedule, I'm like, okay, I'll get that cleaning, my second cleaning of the year, and then 8 months later, I haven't hit it up yet. And so, but the once you understand the flexibility, and I think Clary does a phenomenal job, and we'll talk about this a little bit later, of how they outline just what you can save, and how you can save through a membership plan. When I started in dentistry, again 7 years ago, one of the first things we did was create a membership math, like basically a sheet that told you what you were saving done on paper that the teams would do, or the employees would do. And it's kind of funny, Cleary has taken that to the next level, making it so automated. And it's simple math. It's very easy once you see. I worked for Disney Vacation Club when I was at Disney, which is their timeshare arm, and they do this very simple equation to someone. If you go to a Disney hotel for the next, 20 years, how much are you going to spend versus using Disney Vacation Club? You're like, whoa, I'll save $9,000 or whatever it is, or $20,000. The same thing can be done on a membership plan, and it's a marketing tool. So it's a marketing tool when the patient is looking online and when they're in the office.
I've got a couple of questions from registrants, and then I'll jump into the next poll question here. But this one came in. What are dental buzz or procedural words that attract new patients?
Yeah, so this is a great question. If you kind of look at it at it's convenience, cost, or I say it's convenience, customer service, and cost. And so when I say convenience, it means, what's your availability? Can they get in? Patients want in very quickly. We know that when it comes to a cleaning, most patients want to be seen within set or under 10 days. And there's this, every type of if it's an emergency, you have 1 to 3 days max to get that patient in. Some people need in today, but there's, they have a toothache, but I can be seen in 2 days. That's completely fine. But the convenience of getting in and the convenience of scheduling. So if you don't have online scheduling, typically practices are seen a 30% less, or 30% less in demand than practices that have online scheduling on their website. So convenience of being able to call, to schedule online, and then to be seen quickly is a big one. And then customer service, or in this case, customer care or patient care, but it is huge. That's where we go back to experiential marketing, of being able to use your marketing to showcase what type of practice you are and connect with that patient. They want to go to a practice that they see is clean, that has good technology, that relates to them, and of course cost. Those are the three things: convenience, patient experience, and cost. And that cost is, we recommend to every practice we work with, have a whole financial section on your website between what insurances you offer, your membership plan, and then we recommend having your fees on your website as well, because that's a great way to get in front of people who are looking for second opinions. So they're looking, but the fee, especially with the insurance reimbursements, or what your costs are, can go from zero to like $400. And so those three things: convenience, patient experience, and cost.
Another question. Where do you see most DSOs or dental practices exposed when it comes to marketing? So I guess when they mean, are they spending money in areas they shouldn't be, or maybe they are not investing where they should?
Yeah, the biggest issue I see, and I'll use DSOs, the ones that we work with, is the biggest issue is that they tend not to look at the operations as much as they should. So what they're doing is they're trying to, overcome a lack of new patients by just putting more Google ad money onto it. And so DSOs spend an extraordinarily high amount of Google ad spend compared to like individual practices or small group practices. Very high, because they're trying to fix the problem by just spending more money, instead of looking at what's happening with the practice and then building the marketing around what's happening with the practice. Because you can spend more money all day long and get a marginal gain, or you can take and say, okay, I'm going to spend 3,000 more on ads. Well, put that $3,000 into the practice and hire someone else to help answer phones, and you'll get a much higher return off of that. So that's where I think they get exposed the most, is just thinking that ad spend is going to fix the problem. And also from a DSO standpoint is really, a lot of times they'll put money into practices that are just operationally going to fail. And there's everyone out there listening probably is here probably understands this, that if you have like a 50 practice DSO, there's five of them that no amount of money is going to fix that from a marketing standpoint. So we actually recommend, and we have some tools that we use with DSOs to showcase, okay, what's the top performing practices and how much more if I put marketing spend into those practices, how much more will I get as a company in terms of revenue? Rather than taking $20,000 and trying to fix five practices, you can take $20,000 and take it towards your top performing or your practices that have the most emerging opportunity, and you can get $200,000 out of it.
Yeah, there's a lot of underperforming practices out there. It's not talked about a lot, but that's absolutely the case. All right, I've got a quick poll question here, second poll actually, with two questions. So that should pop up on the screen and give everybody, just from a membership standpoint, what are you doing? Do you have nothing? Do you have an in-house plan that you built yourselves? Do you have somebody else running it, third party? Or are you evaluating options right now? So a couple more folks answer this one. That'd be great. Looks like I've only got a couple of responses here. So, okay. All right. Give you a couple more seconds here. And then we will. And then the second one, which everybody was kind enough, which I didn't read off. How would you describe your decision-making stage? So you're just learning, or you're already live. You're looking to optimize. Okay, I will end the poll, and we can share some results here. So it looks like we've got a little bit of everything. We've got 50% that don't have a membership plan today. We've got one that actually has their own in-house plan that they've created themselves, and then somebody right now that's actively evaluating. That's good that you're on this webinar for sure. A lot of people just learning and gathering information. It can be daunting for sure. There's a lot of questions and options out there, and somebody already has one live and they're just looking to make the best use out of it. So great, thank you. That helps us out a lot. So I think we can move on to the
All
next.
right.
There we go. Thank you.
Yeah. So the membership effect, and this is kind of, marketing and memberships is our topic today. So let's dive a little bit more into what memberships can offer to a practice. And again, this is something that we've been very early on with the practices we've worked with, back in 2019, pushed for memberships just because of the value that you have. I say any patient who does not have insurance, and if you do not offer them some type of membership plan, you're missing out. And we have practices that 20 to 30% of their patient base are on some type of membership. Think about those numbers. If you have 1,000 active patients, you have 200 memberships. That's an extraordinarily high amount of opportunity there. That's a high number, but it's out there. And so I think if you look at some of the data here, that the memberships, when you have a membership plan, have between the amount of visits that you get, which completely makes sense. If you're paying for memberships, you're going to be more active in coming in, and then that you're getting a 20% discount on those services. Like, goes back to that 146% more procedures, cash production, the retention. All of those things are true. And when you look at the data that we look at when we analyze the practice work with, this lines up perfectly with that. The best performing practices, we have a couple of single location practices. We have three actually that are 10 million plus, and they have extremely strong membership plans. I look at that as almost the foundation, because, insurance, it can change from year to year, especially with employer or what's going on. Someone loses their job. There's a volatility with insurance, and there's frustration when it comes to practices working with insurances. And then cash patients, great patients, but they're also going to have some volatility because they're often going to come in when they need something, and then they might not come back again, or they might not come back again until they need something. But a membership is going to be far more consistent, which goes back to something that I said earlier on: is consistency is king in dentistry. When we talk to practices, I want to have a boring call, because a boring call means that they're growing at the consistency, and we're not having to fix problems with PPO or not insured.
And I'll add a couple other things to this slide, which I think that when you look at, so this is comparing uninsured patient behavior. So these are people that didn't have insurance, and then what things look like 2 years after being in a membership plan. So it's, that just gives you an idea how many, so think about how many uninsured patients do you have? And if you were adding a membership plan, what would this do to those patients? And being one of those patients that doesn't have insurance like you, Ryan, I'm also, and I think most are aware because they maybe had insurance in the past or are aware of it, that they're paying cash when somebody else, another patient, might be getting a similar service for less money or getting
Mhm.
some special benefit. So I think that's another thing as a cash paying patient. You've got to realize that they realize that they might not be um, getting the best deal or the best um, package from their practice.
Yeah, it's think of Costco. I use this analogy often is I pay for a Costco membership. Guess what? I'm going to go to Costco more often than I am any other stores because I have the membership with them. I mean, obviously I see the value. I look at it as, oh, there is, essentially a built-in discount by buying in bulk through them, things like that. It's the same thing with a membership. You're going to be more endeared to the practice that you're buying that membership from. And so it completely makes sense that these numbers here, represent what they do versus a non-insured patient.
Yeah, and I'd say that, just I wouldn't the fee is not so much the issue when it comes to membership. I think you gotta have to look at what it does as a commitment. And I know that we kind of look at these things whether, you have a gym membership or something else where it's like, I'm going to actually go see the doctor because I do have a membership plan. I'm committed to the practice, and I better take advantage of this membership plan. Versus, to your point earlier, Ryan, I'm a cash paying uh, patient. Well, you know what? I don't need to go right now. I'll just go when things aren't so good, or when maybe I have a little more cash in my pocket, or whatever. But there's not that commitment to it, the
Yeah, and
practice.
one of the things on here that or is not on here is that we know based upon the demographics that we look at that someone who purchases a membership is more connected to their health than somebody who is cash paying or even PPO because they've made the commitment to that membership plan in terms of again from a health standpoint or oral health standpoint. So they're going to be more likely to accept treatment or even take elective treatment that other patients wouldn't.
I think the next slide, we've got some more questions that we've got here from the registrants. So I'll kind of hammer through these. I got a bunch of really good ones. Patient acquisition. What is the very first action item to build from? So when somebody's looking at creating a patient acquisition plan, what should they start with?
Yeah, 100% your online platform. That's the easiest thing to get up and running, and that's the foundation of your practice. We'll people to come and say, I'm in the middle of Montana, with my practice. I'm not in a big city, but guess what? A majority of patients, and we know this, that based upon one of the largest studies done on healthcare and within dentistry, found that 92% of new patients visit a dental website at least once when they're choosing a new dental practice. And so 92%. So yes, you may be in the middle of nowhere, but getting that foundation up and running is going to give you the opportunity to convert, which you don't have without having it, and making sure that your website is present and showing up on searches. Getting Google Ads going is important. Again, depending where you are, Google Ads is the leading source of conversions at this point, or leading source of new patients is through Google Ads. And then organic and AI searches next, and then direct or people who are referrals to the website are on there as well. But getting that foundation going, and what we know from a data standpoint, that if you get a strong foundation, that'll represent about 60% of your marketing strategy, or 60% of the new patients that come in. And then what you do is you look at the practice to refine your strategy individually to your market and practice after that, and that's about that 40%. So getting that up and running is a game changer, and ensuring that you're actually showing up on searches is the first thing that I would do. Once you obviously have all of your infrastructure put in, your operations going, is having that website up and running.
What is the most cost-effective method to attract and retain patients? And I should say most effective. So cost efficient, least expensive, most effective,
Yeah.
and way to attract and retain patients.
Referrals, hands down. If you can get a referral, that's going to be your cheapest option of marketing. We typically see around 40 to 60% of new patients come through referral for good practices. So that's a good number to go off of. And the rest usually come from then like an online source. So that's going to be your number one way. Your second, I'm going to kind of go down a list here. Second one would be Google Ads. Most in most areas, if you can keep your cost per conversion, like we usually see $40 to $100 for a cost per Google ad conversion. And with some practices, they're doing like $10 for a cost per conversion, extremely low. But if you can get that going, that's a very cost effective way to bring in new patients as well. And you can target specific patients that way. And then just your organic and AI searches as well. So in that order, but referrals, I mean, that's word of mouth. But the interesting thing too with memberships are that membership patients have a higher opportunity to refer somebody than any other patient. Again, just because they're connected to their health and they found something that they believe is valuable to them. And it's something that they know that, if I have an insurance, I may not be able to connect with my friend who has a different company insurance. But if I'm like, hey, I don't even have insurance. And I tell people all the time, I don't have insurance. I use a membership plan and I love it because I'm connected to it. So I'm more likely to refer that way.
Question about leveraging AI in marketing.
Yeah, if you're not using it, then it's, I equated it a couple of weeks ago to, it's like using in those old AOL internet CDs. When I was in college, I worked for Blockbuster Video, which is aging me, but I worked there and he gave out those AOL CDs all the time. That's where you would be if you're not using some type of AI technology now, because what that again, it allows you to get in front of a patient who you want to come to your practice. You're not just guessing anymore. You're not just hoping for the best patient. You're able to actually put content on your website and build a plan through organic searches and AI searches and then ads that's going to get a higher value patient. So what we've seen this year, and our websites are all built off of an AI platform now. We transitioned started about 2 years ago on a transition program to do this, and then that what's built into them, we've actually seen the number of visitors to websites decrease this year, but the number of conversions increase. So again, the number of people coming to the site has went down, but the people attempting to schedule through a call or schedule online has increased. It's because we're able to get in front of more new patient or in front of the right new patient, and you need less of those. And then another interesting thing is we've seen a 12 to 18% increase in production per new patient. Why there's a variable there is just because we have some surgical practice, the super GPs that have a higher opportunity to get more revenue as well. So AI is the backbone of what you need to be doing from a marketing standpoint right now.
And there's building a strategy for SEO and then GEO, right? Which is so that and that can be different. And a
Yeah.
lot of that is through content creation. And go ahead, Ryan.
Oh yeah, yeah. So we recommend a lot of practices we work with to create video content because we know that's going to help a lot. So that, put it on YouTube, put that onto your website. That's going to help answer questions. Like I use AI for almost everything now, between the Gemini, Claude, and so having your website be able to answer questions, that's how you're going to get in front of those searches. And one thing that's interesting too is with having an AI optimized website is that you're going to get in front of a lot of second opinions for someone who's seeking more information on should I actually do this? And it could be a two, three, four, $5,000 case or even higher, and they're looking for basically more information. Well, if your site is coming up on one of those prompts or those mentions within AI, that's going to give you a higher opportunity to capture that second opinion.
There's a question around consistency when it comes to attracting patients. So let's talk a little bit about that because you there was a question at the beginning of the presentation that was around the how many new patients per month or how many new patients for PPO practice in a suburban area. So you kind of figure out whatever that number should be, but then how do you consistently attract patients? Like you've got to kind of set a plan, but then are you constantly refining that plan?
Correct. Yeah. So, the consistency is ensuring you have consistent blocks, first of all. The number of practices that don't use any type of new patient block system is very high, and that's going to cause your inconsistency right there. If you're a pediatric practice, I know that's much harder to do, but like for a general practice or a super GP, setting aside the number of blocks right off the bat for every month is going to give you the opportunity to have consistency. And it also is going to allow you to measure your marketing better. So we know that typically you want 30 to 40% more blocks than you want of your goal, because that's just a formula that maximizes. So if you want 100 new patients, you need 130 to 140 blocks. That accounts then for cancellations, and just for lack of availability when there's less appointments, that fit a patient's schedule. And so if you have that consistent number every single month, you can say you're going to have more of a consistent new patient flow. And then you're also going to be able to actually determine if your market is working. Because if you have that consistency and you're not filling or you're filling, you can look at your marketing easier. Whereas practices that don't have that we work with, that then go back and say, well, I wanted 100 new patients this month. And like, we only had 50 new patient blocks. How can we tell how well the marketing's working if you don't even have enough availability to fulfill your goal?
So this question is about scalability, and one there was at least one person on the webinar that works for someone that has over 250 practice locations. It's another that was, I think, somewhere in the middle, about 30 or 40 locations. But from a scalability perspective, how do you build a patient acquisition strategy for 250 plus locations? And the one thing I'll say about when we go back to membership plans is the cool thing about a membership plan, if you've got 250 locations, they're not going to be all the same, right? There's no way that every single practice can be the same. So you can change or tweak the membership plan based on the type of patients you have in an individual location, and even, change up what the membership plan will cost or what the offerings are. So I think you can be scalable, but also be unique to each practice location. But I said a lot there. Scalable patient acquisition engine. How do you do that with 250 plus locations?
Yeah, so the biggest thing is ensure that you have a platform that can easily impact all 250 locations. And so, having a website platform and an ad platform that is talking to all of them and not individual, just individual, like, oh, this practice is doing this practice is doing this. So you need to be able to scale and easily onboard a practice quickly, but have the foundation of that, be similar between all those practices. And so once you get that set up, then you're able to measure easier to understand what's working and what's not working. Because if you have, practice A over here on one website doing one thing, and you have practice B over here, and they're not similar at all, how do you even compare what's working and not working? And so then you start to just pick and choose different things to try. And to be honest, like, from a marketing standpoint, we work with DSOs, we work with individual practices. We like DSOs in the markets we're in because they don't do typically a very good job of marketing. We can outperform almost any DSO out there because of the fact that they're typically not very well organized. And so I know I'm speaking to a group of DSOs here, but it's just the truth. When we have a practice, individual practice says, hey, there's a new DSO moving down the street. We like that because we know they're going to overspend typically on marketing, and we're going to be able to customize that practice's strategy to take advantage of that DSO's weaknesses. So, but the DSOs that are strong, though, that do have a presence, and there's a couple out there that do this well, and they are consistent in what their platforms are doing and how they are marketing, and then they're doing individual plans once they get the foundation built for those with their group.
Let's go into a poll question here real quick. So you can answer as many of these as you'd like. They could all potentially be a problem, but biggest new patient acquisition challenge right now Is it the rising cost per new patient? Converting calls leads into booked appointments? Is that not working? Attracting uninsured or cash pay patients? Inconsistent results across locations, which we were talking about earlier, or patient retention and reactivation. See if we get any more here, and then I'll let you, Ryan, actually respond to the results. They are pretty interesting. All right. So it
All
looks
right,
like
let's take.
go ahead, Ryan. What do you think?
Yeah, so right, like I say, rising costs per new patient. I mean, that's a little bit of a truth there because Google Ads is becoming more and more of a way to get new patients. So that I see some of that. Converting leads calls into booked appointments 100%. I mean, that's right there is a very big issue, which is hands down. So an interesting fact of the fact or that we've again analyzed so many calls. The average practice in this country only averages over 60% of their calls. I mean, is answering over 60% of their calls. And so that's a big issue right there. Attracting uninsured cash patients. Yes, that is a big issue. I think it's difficult unless you have a strategy that is speaking to them. Because here's the thing: is you want to build your practices to be able to attract, obviously, PPO, unless you are a full fee-for-service practice, but you need to be able to have this balance of PPO insurance patients and then uninsured and members and cash patients, things like that. So it's a little bit harder to balance that. But one way to do that is to really put if I don't have insurance and I'm searching or I'm on AI or I'm looking through ads, there are certain things that I'm doing that can signal that I don't have insurance. And so if your marketing and your online, your website and your ads are not addressing or speaking or putting, looking at those keywords for what people are searching for when they don't have insurance, you're going to miss them all day long. And so, there's a little bit of secret sauce there of how to get in front of those patients and how to essentially to seek more of those patients out. There's you always want to analyze the patients you have. So you would take, okay, if I have 100 cash paying patients, you want to be able to analyze those 100 and see what makes them the same. Especially with AI now, you can do this. We have an AI tool that we throw in a bunch of information on, demographics of practices, and then we go after more of those types of patients. And so again, you can pull out certain data points off of a cash paying patient or a membership patient, and then you can set up your marketing to find more of those. And then inconsistent results across locations, 100%. That's going to be, almost fully based upon the operations of the practice, or it's going to be, I guess, a 50-50, or it's going to be based upon the fact that you're just doing the same ad strategy that you do, say, in Chicago as you would do in Springfield or something in Illinois. So needs to be an adjustment of strategy. So patient retention activation. Is always a challenge, and I mean that could be a whole another hour podcast just on that one.
Yeah, for sure. Well, great. Thanks for that.
Yeah,
We're about 7 minutes left, so we will let's jump into the next slide real quick and
yeah,
kind of so those were the questions actually. We already had them up there. So
yeah.
I
We
think
already
we
asked
went through all
that,
those.
and we went through I think a lot of this of just real quick.
Yep.
Go affordability. Make sure you're talking about why your practice has financial options. If you're not talking about financial options in your marketing right now, you're going to miss out on a bunch of patients. We talked about referral, Google Ads, line marketing with operations. That's a big one. One quick thing on marketing and operations is you want to be able to have your marketing adapt quickly to your operations. So if you are a practice and you all of a sudden lose a hygienist and now you're booking 3 months out for a new patient, you want your marketing to adapt quickly to limited exams to fill up that doctor schedule. So if you are not have a marketing system or strategy that can do that, you will miss out all day long. So make sure that your marketing can adapt to the type of appointment that you have availability for.
Yeah, I think that's a great point. I don't want to dwell on that, but I think that's super important. In fact, we have on our editorial board a member of a DSO who is both COO and CMO. So they have that aligned so well that that person controls both marketing and operations.
Yeah, it's good. So
Yep.
yeah,
On
go
the
ahead.
on the Cleary side of things, on the membership side of things, just wanted to kind of point a couple of things out that Cleary's really invested a lot of money in not just being a membership plan, but they've built out a lot of things like their Cleary Bridge, where it connects with the PMS schedule. So you can actually read the day's schedule, you can flag members and kind of look at the members that would be ideal for membership plans, or when I say members, patients that would be ideal for membership plans. So they've got that. They made it easy to actually enroll at the front desk, about 30 seconds for the membership plan. So it's pretty quick. And then they actually now have patient financing through Cherry, and that can be pre-approved. So they've streamlined the patient financing as well. And then since this webinar is all about marketing, Cleary's actually provides a marketing toolkit to really re-engage people that have membership plans, especially if they have open treatment. So I think that's something to kind of take a look at too. So they've really tried to take a lot of different solutions and just streamline that instead of having, patient financing, where you might have that, but it's not necessarily connected to your membership plan. Make it easier to enroll in a membership plan, or even including this marketing toolkit, I think is great.
Yeah, and I want to mention I've talked a lot about I'm a big fan of Cleary. Grapevine, we're a company that we don't take any type of referral revenue share from any companies that we partner or endorse. I was introduced to them a few months back, and I was like, this is the solution for the practice, because we know if a practice is using something like this, they're going to be more successful, and that's going to obviously impact their marketing and what we do. And so I can't speak enough about everything that I've seen them do and how their platform works. And so I can't speak enough of just, hey, check them out and see if it would work for your practice, because it is an amazing tool.
The question here is, this just came in, is Cleary Bridge standard or an add-on? Same question for Cherry. My DSO actually has internal member plans for about half our company. I think maybe that means in-house plans. And utilize Cleary for the other half. So not 100% familiar. We've got Liz. I don't know if you can unmute and answer that question. Oh, wait. Bridge comes with Pro. Okay. So that would be considered an add-on. And can you is that a thumbs up if Bridge is an add-on?
Yes, it is a little bit of an add-on, but it's offset by the cost of your, so if you have I believe right now the threshold is about 150 members, there's no cost for Pro. So the
Got it.
more your membership grows, then that cost comes down.
And Steve, we can follow up with you. It's a great question, and we appreciate you asking that. Um, Ryan, if you want to zoom over to, yeah, there we go. So if anybody is interested in learning more, and actually this is great, if you scan that QR code, you can actually get a copy of the dental membership marketing playbook. And I think that's the one QR code there on the left, and on the right, if you just want to learn more about Cleary, you can hit scan me. Got one more poll question, and then I want Ryan to be able to give you a little bit more. And we'll have the links. So if you don't want to scan those, I'll send those links out tomorrow to both of those. So you'll have those as well. Last question. If you want a Cleary platform walkthrough, you can, answer or an ROI assessment. We can do that. If you want Ryan to reach out to you, feel free. I'm not going to disclose. I'm not going to share these results. So just go ahead and just answer them honestly, and then we'll get back to you for sure. And Ryan, do you have contact information if people want to reach out to you?
Yeah, if you go to mygrapevine.ai, so mygrapevine.ai, you can fill out a form there and we will jump on a call and help evaluate. Like I said, we work with a lot of DSOs. We have in time that our company's been around. And so we have a lot of tools that are very effective from a DSO management to create that consistent foundation that I think is often missing on that DSO side. So happy just to give advice anytime. Go to the website. We have a lot of resources too from books that we partner with some doctors who are some great authors that we can just send you just for reaching out to us. So
Excellent. Well, thanks so much, Ryan, and thank you to Cleary. And for the couple of groups that requested the membership plan ROI assessment, we'll follow up with you and get that out to you as well. But yeah, look, we're good. We're right on time, and I think it was a great conversation, Ryan. I appreciate that. Any like final 30-second thoughts?
yeah, again, thank you for having me on. This was great. And, the biggest thing is, and I can't say this enough, is just know your numbers, know your data, utilize the tools that are out there from AI to analytics tools to be able to understand what's happening with your DSOs, with your practices, to be able to make the educated decisions. 'Cause if you don't know your numbers, you're never going to be able to make an educated decision.
That's great. And thank you, everybody. Like I mentioned earlier, the recording will be up on our website, and that should be in the next couple of hours. It takes a little while for it to process on the Zoom side of things, but you'll definitely have access to that. And we'll be following up with everybody with an email tomorrow. But thank you, Ryan, and thank you to Cleary, and everybody have a great rest of your day.